advertise another drug without their support,
Oh,
their sponsorship.
yeah, for sure. Okay.
All right. Julie's getting surgery Monday.
Yeah, I am.
We sent cake to the doctor's office. They didn't say thank you, so I'm a little bit butthurt because I personally chose the cake I was sending, but
Okay, so here's an update. Hello, everyone. This is a TENS unit that is connected to my hip, which I like to call it my ham hock.
I wish I could have access to that. Could you imagine? You start getting snappy with me, up.
You're obviously out of line. You have no idea. Okay, at any rate, so I am having surgery on my lumbar spine on L5S1. I had that surgery in 2021, and guess what? It needs to be redone. So kind of bad news, kind of good news. The good news is we know what it does. We know what the problem is, and therefore we know how to fix it. So
and the good news is Julie gets to spend a whole day with me.
Well, luckily I'll be on general anesthetic for the majority of it. But here's the deal. Access to care and prior authorizations. We just did a little piece on our YouTube channel of our podcast on prior authorizations. So I just want to put it out there that prior authorizations in the world, according to Julie, is nothing but a hard stop for an insurance company on them wanting to control anything a physician does, anything a mid-level does. So, it used to be that our prescription for drugs or procedures or MRIs or imaging or whatever, that used to be enough, but it hasn't been like that forever. And these insurance companies and the PBMs have completely gone over the opposite rail, and now they want us to prior authorize inexpensive drugs like methotrexate and folic acid,
Tylenol,
whatever it is. They want it because they just want to control. They want to control everything, and they think they know better than your doctor, and that sucks.
Well, they're not even saving us money. Let's be honest. We've realized it in the best way. Julie, she's using her insurance because we're almost positive she'll meet her deductible, and
I don't even know what my deductible is. It must be like $8,000 because I've paid so much money already. So for this lumbar this micro discectomy that I'm having on Monday, the first they gave me an appointment that was like 2.5 weeks because they needed to prior authorize it with my stupid insurance Anthem.
Then Julie called in her assistant,
and then we sent a bunch of cake and to them and said we really need to come in as soon as possible. I offered to pay them cash.
I offered
as opposed
Starbucks.
to not using our shitty insurance. I offered to do my own prior authorization.
Offered for me
Whatever.
to do it.
I would have done my own too. That's why when you hear me on the phone saying this is Sarah at Dr. Bach's office, that means I'm doing my own prior authorization. But I'm getting my surgery on Monday at 7 a.m. She's going to take me, and I'm going to not have sciatica pain and L5S1 pain on Monday. I already know this drill.
This woman is so crazy. She said we had people coming in on Wednesday, and she's like, I'll be here Wednesday. And I'm like, Julie, I'm going to call them and tell them to move when they're coming in because you need to relax. Like, I don't want you to over execute something and then we're back at square one. I'm not a doctor, but I know you're supposed to rest.
So you
won't.
So here's the thing. I've already been through this surgery in 2021. I know that the minute I get off that operating table, I'm not going to have pain.
For real, take it easy.
I know. But I've got lots of work to do, and our patients need us to do work. So I'm going to do what I need to do to get back in here as soon as possible.
We'll have her arguing with people on the phone from home right after the anesthesia wears off. She's going to be like, give me Express Scripts. I'm ready.
Yeah. Well, you know what? It's kind of funny.
I will come out from Texas and personally make sure of it.
Perfect.
You're not doing nothing.
I have 2 guest rooms in my house. We can put you in one. But here's the thing. I already know what the treatment is.
That's what I say after my first dose of prednisone.
Yeah. I mean, I'm not even taking prednisone now. I mean, it's really bad. But I know how it's going to be, and I'm going to be like literally so much better because I won't be in pain. So I can't sit. So all I can do is either stand or lay flat. which is kind of some shitty, you know, it doesn't work well when you have to work at a desk. So I stand at my desk.
She paces whenever she's arguing. So
I do.
the fact she can't move, I think, makes her even more angry.
Yes. But listen, I only need to make it till Monday. All right. And then I'm going to be good and I'm going to be back. And I'm not going to need a ton of time off. I'm just not.
We're going to give her 72 hours off.
I am built to do this. And I have got a stack of patients I need to advocate for. And by God, we're going to do it.
This is my time to shine, guys. Don't you worry. I'm going to get her to rest and she's going to shine or I'm going to shine.
Okay.
Oh, good luck.
So,
I have Caremark. I used to have TRICARE Express. Oof, there's TRICARE Express Scripts?
Yeah, of course, Express Scripts has some, they run the long con with the military. So unfortunately, all of our amazing service personnel have to be mandated to those shitheads at Express Scripts.
Well, that makes a lot of sense, actually. No wonder Jack just kept getting his medication sent to him. He'd be like, someone stole it from my mailbox, and then more pain medicine.
Okay. When the United States government is picking up the tab, why wouldn't Express Scripts continue?
Let's take out every organ.
Yeah, let's have a Barney birthday party at Express Scripts. That's what they do.
Seriously.
So this is what we're doing. We just booked tickets to go to Oklahoma City.
Who are you excited to see?
In April, and Marty McCary is going to be one of the speakers. I bought his book. I have a man crush on him. Man crush, an old man crush. I don't know. He's probably older than I am, but nonetheless, I'm super excited to meet him. And
Chris Deegan will be there, and I want to be best friends with her because she's a lawyer.
And you've already met her before.
And I have.
But Marty McCary is going to be doing a picture with the two of us. He doesn't know it, but we will be doing that. The first time we saw Wendell Potter speak, I ran my foolish ass right up to the podium and like, Wendell, picture with me.
She beelined. I was like jogging to keep up with her. We got it. And there's this picture and you can just see the pure joy in both of our faces.
Yeah.
For this like 78-year-old.
Yeah. A business crush on a 78-year-old Wendell Potter. So I'm really excited about this conference. We're going to actually, Dr. Bach is going to go with us. So it's the two of us and Dr. Bach.
We're going to see Nilsa. So we'll definitely get some guest speakers there. We can have a table talk.
Yeah. You know what? You need to really bring all your chargers because we're going to be coming live from Oklahoma City. And we're going to get to go tour the surgery center of Oklahoma City.
They have all their surgery prices listed on their website. So if we were to go in to get her back fixed, they'd be like, this is how much it's going to cost. No BS.
And trust and believe that yesterday I got my appointment booked for my surgery, and it's going to be at Christian Hospital here. Do you know that the Christian Hospital BJC, that's Barnes Jewish Christian, they already sent me a thing that estimated that's what we should have shown them. The estimate of the patient portion is like $2,900. We're going to show this. Should I go get it?
Yeah, go. Can you?
I think I can get it.
She's going to walk slowly. Don't worry, guys. I want to get started in this field to make a difference. Tips: any entry level job, start at a receptionist and then just work your way up. Show them you're ready to fight. You've got to make sure she rests. Oh, trust and believe. I'm on it. I know all of her sore spots, so if she doesn't listen to me, Emma's coming right up here.
Okay, who wants this? I am the patient. My name is Julie. Okay, this is the estimated this is so freaking great. Okay. Here's my, is this backwards when I see that?
Nope.
No? Okay, great. So here's my patient estimate. All right. So this is for my laminectomy that I have to have. So I have to pay $2,969. But do you understand that the insurance industry is so corrupt and so in bed with these hospitals that they act like the insurance covers $35,000? They don't. Okay. You pay $2,900 and that's it. So if you really look at this, my max out of pocket is $6,366. Okay. So see this? Nobody's paying $38,000. No. Nobody. What the insurance will cover on this is absolutely nothing. Okay. It all goes to my deductible. But do you see how they try to confuse people and act like my insurance is paying $35,000 of the $38,000? No. The reality is the surgery is going to cost $2,969 and I will be paying 100% of that. And here's the craziest thing. I had to pay this bill yesterday because I didn't want them to give my spot to someone else. So I've already had to pay this. So thank you, Anthem, for absolutely nothing. This is such crap. Such crap. Nobody gets $38,000 for this simple surgery. And to honestly say that my insurance, stupid Anthem, is paying $3,500, that's nonsense. That
Look on
is the cash
Oklahoma
price.
Surgery Center price. That's probably the price they're paying.
No, what the price of the surgery is $2,969, and that's what I had to pay.
Yeah, that's
So
definitely.
anyway, I'm a little salty about that.
But when she
reality
gets salty,
is-
her hip stops hurting as much.
The reality is, I need this surgery, and I need it, and I need it now. If I could do it today, I would absolutely do it.
I was
But I will
trying to
be there
bribe.
on Monday.
They wouldn't let me. We got it Monday though, which I still think's a win.
It's a huge win. It's a huge win. We got it in February. I didn't want to push to March. So
No. But yeah, so stay tuned to subscribe to our YouTube channel. It's linked on the page, or it's Don't Back Down, DONTBAAKDOWN. Bye.
bye, everyone. Okay, how many people?